Hi, everyone, and welcome to our Group 6 presentation today. My name is Tommy, and I'll be introducing our topic, which is plantar fasciitis. And we'll be looking at the effectiveness of various therapies using a network meta-analysis that we discovered. Basically, to start, I'd like to introduce plantar fasciitis as a disorder of the connective tissue which spans the arch of the foot. It's responsible for a majority of the incidences of heel pain experienced by millions of Americans annually. This condition is very common among certain cohorts of individuals, certain people such as athletes, particularly runners, also pregnant women, or anyone who has footwear that frankly does not support their foot well enough. So the plantar fascia is a thick band of fibrous connective tissue that can be divided into three portions. They arise predominantly from the calcaneal tuberosity and insert on the heads of the metatarsal bones. Now, this thick fibrous band of connective tissue plays a crucial role in gait. It provides support to the plantar aspect of the foot while undergoing tension from the load of the body. Plantar fasciitis is the result of degenerative irritation of the plantar fascia origin at the medial calcaneal tuberosity of the heel, as well as the surrounding parafascial areas. The cause of plantar fasciitis is multifactorial, but in most cases, it is the result of overuse stress. Plantar fasciitis is often an overuse injury, as I stated, primarily due to repetitive strain that will cause micro tearing to the plantar fascia. However, the cause can also be a result of a trauma or additional multifactorial causes. Some predisposing factors are pes planus or flat foot, pes cavus or high arch, and individuals with limited ankle dorsiflexion. Interestingly, there's a bit of a misnomer in the formation of the word plantar fasciitis, as there's notably a lack of traditional inflammation, usually described by the suffix itis. So our group spent time looking at a meta-analysis study where 19 randomized controlled trials were considered with a total of 1,676 patients, all of whom had plantar fasciitis. The aim of this body of work was to effectively compare the effectiveness of each of these various treatment options. Relief of heel pain was the primary outcome of interest. To go further into that, we'll hear from Shane Evans. Shane?
Hi, my name is Shane Evans. I'm going to be going over the current understanding. Next slide, please. So the study did look at 19 controlled trials, and in particular, these patients, they were older than the 18 years of age, so they are considered adults. They are non-athletes. There was no previous fractures and no prior surgeries involving the heels. Next slide. Now, the patients, they looked at different treatment methods. These include the radio extracorporeal shockwave therapy, focused extracorporeal, ultrasound radio frequency treatment, and intracorporeal pneumatic shock therapy, low-level laser therapy, and non-invasive interactive neurostimulation. Now, I'd like to add for a focus, there was 3 different intensities, which is low, medium, and high, and they were also compared for their efficacy. Next slide. Now for the treatment modalities, there were 3 follow-up points, which there's the short-term, intermediate term, and long-term from 0 to 6 weeks, 2 to 4 months, and 6 to 12 months respectively for those. Next slide. Now, the outcome of interest was a change in pain relief, and there was different scales that were used in this analysis, but the main validated scale was a visual analog scale, as you can see in the slide, with the happy face to 10 to the sad face. Next slide. Now for short term, there from 0 to 6 weeks, there was changes in the radial, ultrasound, intracorporeal, pneumatic, low-level laser, and non-invasive interactive neurostimulation. Next slide. For the intermediate term, there was a change in radial, ultrasound radio frequency, and high focus extracorporeal. Next slide. Now for long term, again, that showed up from 6 to 12. There was a change in the radial shock, the ultrasound radio frequency, the non-invasive, and the intracorporeal pneumatic. Next slide. Now, what was found statistically was that the radial shockwave provided more pain relief compared to ultrasound radio frequency and the placebo. And what was also interesting is that the radial shock was more superior than the focused shockwave therapy at all intervals, meaning there's a change in pain relief in the short term, intermediate term, and the long term. Next slide. Now, the radial shockwave therapy, it was the most superior method. As you can see, it showed differences. It showed a change in pain relief in all of the intervals / the short, intermediate, and long term. It was the one that was most effective against the fasciitis. And it showed superior change in pain relief at all intervals, like I said. And there was better patient tolerance, so there was no anesthesia. And you can just do it over the foot or over the heel, effectively, and the patient wouldn't feel anything. Next slide. Now, the intracorporeal pneumatic shock therapy, this one was also well tolerated under local anesthesia. It's much cheaper and it's more readily available in all hospitals, and patients can actually recover quickly after this treatment. And this concludes the end of my presentation. This will be over to Kai.
Hi, my name is Kai, and I will be discussing the results of our meta-analysis. So the different treatment modalities that the meta-analysis looked at, they differed in their types of energy. The energies they used were sonic waves, mechanical oscillations, heat, and light. And also depending on the effects they had on the tissue, depending on the intensity, stimulus frequency, pulse interval, treatment duration, and how the stimulus was applied. And the best outcomes for each time frames were the neurostimulation from the 0 to 6 weeks, the radio shockwave therapy from the 2 to 4 month interval, and then the IPST, which is the pneumatic shock therapy from the 6 to 12 months interval. And some treatment modalities that they found insignificant were the medium focus shockwave therapy and the high focus shockwave therapy and ultrasound. These three were found to not be better than placebo. And another treatment modality that they found to be high risk and not beneficial was the ultrasound guided pulse radio frequency, and the benefits were insignificant. And even with the ultrasound guided needle, there could be a risk of damage to the nerve. And then further data is required for these four, IPST and NIN. They only did one study, so there wasn't enough data to prove that this was clinically viable option. And then the laser therapy was also deemed insignificant because they didn't do any long-term studies. And then the ultrasound guided was also, there wasn't enough data, and it's also potentially dangerous. And some strengths of this meta-analysis is that all the potential treatments were included, whether there was a lot of data on it or if there was very little data, and all the p-values were less than 0.05, which means all the insignificant data were filtered out. And then they used 3 time points for follow-up. And then also the focused shockwave therapy had 3 different intensities, low, medium, and high. And some limitations to the meta-analysis is that they included treatment methods that didn't have a lot of data. Radiotherapy was excluded, and then the quality of each treatment method differed based on whether the treatment schedules or how the dosages of the treatments were being applied. And all the treatment methods that we discuss in our meta-analysis, these are treatment methods that are more invasive and commonly used for patients with chronic plantar fasciitis, meaning that they've experienced these symptoms with little relief for over 6 months. For patients that are having acute plantar fasciitis, more conservative therapies would include steroid injections, painkillers, physical therapy, stretching, night splints, orthotics, and even lifestyle changes such as maintaining a healthy weight, wearing more supportive shoes, and changing from high-impact sports to lower-impact sports like swimming. And here's Dion with future predictions for treatments for plantar fasciitis.
Thank you, Kai. Future predictions and those who want a possible timeline varies. Surgical release is effective in small proportions of patients. Precutaneous ultrasonic fascitoma is a new minimum invasive treatment available for patients who have yet received release from the traditional procedure and physical therapy. This treatment shows promise as patients' recovery time is shortened to about 10 days and recurring pain is absent. Now, this treatment is based on ultrasound technology, which can also treat other soft tissue problems as well. This could be the new standard of treatment for plantar fasciitis. And of course, we always have the traditional option, which is the removal of the plantar heel spur itself. Now, there are also signs of the plantar fasciitis when it is healing. Your mornings are easier. One of the biggest signs of healing involves morning pain or the lack thereof. If you notice your first couple of steps each day are getting more manageable, it means that you're probably doing something right. Also, your pain is localized. If you notice that your range of motion is returning to normal, this is a sign that healing has begun. Although pain may still be present, the ability to stretch the calf, pull the foot toward your chest, and raise your toes are all promising moments for recovering plantar fasciitis. Now, your range of motion is returning despite this pain. Being able to stretch the foot is important. Stretching can help strengthen the fibers in the plantar fasciitis and protect it from tearing in the future. Cramping can also occur, and so enlonging these muscles can help prevent this painful symptom. Visible symptoms are also fading. So if you haven't experienced these signs of healing yet, don't be discouraged, and recovery from plantar fasciitis is a complicated process, and every person's body is going to react a bit differently. And at this time, I'd like to thank our presenters, Thomas, Shane, and Kai, and I'd also like to thank our writers, Trey, Alice, Karen, and Lamia. Thank you.